This is part 2 of our 4-part caregiver series. You can find the links to all parts below in the description. This is burnout and building resilience for the caregiver.
So I guess, right, it's sort of a natural transition into, how do you prevent or help caregivers prevent having, burnout and emotional distress? And what do they need to look out for to be like, ooh, I need to ask for help. I'm struggling here. So I think, right, as you guys both talked about, their needs are kind of put to the side.
Yeah, I think it it takes courage to say I need help, and I think that's the biggest hurdle for help-seeking behaviors is just to say that out loud. I need help with this, and so where we see sort of compassion fatigue or burnout, and the difference between the two is burnout, you don't have any feelings. Compassion fatigue is you feel too much. So burnout is when you stop caring. And there's a different flavor to those. So sometimes people equate those and they're not equal. But, every choice that the caregiver makes, the tone of the household, every transportation, income, food, everything is sort of all centered on the patient. And that is stressful. And to sort of prevent or armor yourself or treat yourself for that, you have to do stuff that energizes you. And I think that's hard for caregivers because it feels selfish. My husband, my wife is sick. I shouldn't be doing things that are fun for me because they're so sick. And sort of what I share with caregivers is if you're so stressed out that you can't think clearly, you're no help to me, and you're certainly no help to the patient. So you have to step back and what refills your cup so that you can be part of the medical team and care for your recipient, your loved one, your family. So yeah, the courage to say I need help, and the wisdom to understand this is not selfless. Addressing burnout and compassion fatigue is important to maintain mental health and physical health. Dr. Patel, what do you have to add to that?
So I think one of the things that I personally experience when I talk with caregivers is a lot of guilt or a lot of feelings that feel like they should not be happening at the same time, right? So maybe sadness and guilt, or relief and happiness, or guilt and happiness, like as Josh had said, life does kind of revolve around this patient, but you also have a life as a caregiver, right? And so kind of the nitty gritty examples that I ask caregivers to look for is kind of what Josh had already alluded to a little bit of, anxiety, depression, you're not thinking like yourself, or maybe other people are saying, hey, you really seem tired or run down, or, do you need anything? It's really easy for all of us to say, no, we're good. I'm okay. And thanks for noticing, or, that might be a moment where you do say, I do need a little bit of support. I also see sometimes our caregivers falling sick themselves. If they experience any changes in sleeping patterns, appetite, weight patterns, I mean, those can be signs that, we might need to give a little bit of extra support to you as well while you're supporting your loved one. So I think that these things happen naturally only because of the extreme stress that we're under. So it makes sense that these, if we're under a lot of stress, our body is going to react that way as well in a stressful environment by having some of these physical changes. So those might be some things to look out for too, not only like internal feelings, but maybe more external.
Let's say people are starting to notice this, right? Caregivers are like, ooh, and I'm not sleeping well. People are telling them they're not looking good, or they're starting to, maybe they're getting up and they're starting their day crying. What are kind of I guess, concrete suggestions that you could offer or suggest to people in that situation to help them kind of navigate this unknown or something that, right? So maybe something they've never experienced before.
Sure. Well, I can jump in. So I usually do a little bit of education first. So our body's response to any sort of stressor, we have three types of responses. So people might remember this from school, but you have fight, flight, or freeze. So none of these responses inherently are good or bad in any way. So I want to remove the judgment from those, but it's basically just a way that our body responds to stress, right? So if we see a threat, whether it's real or imagined, our nervous system is going to have a response to that. So if you are constantly in a state of arousal where you feel like you are constantly on, I have to be prepared, I have to be vigilant, I have to make sure that my loved one is taken care of, they have all their needs met, you're just go, 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 it can impact your ability to take care of yourself, attend to your needs. So what I tell people, some concrete examples is look at wellness. We use the word self-care, but also look at wellness overall, right? So wellness can look like spiritual wellness. It can look like physical wellness. It can look like interpersonal wellness, intellectual. So, what the examples of these might be interpersonal is getting a cup of coffee with a friend, or something social with just you and somebody else, or somebody you haven't seen in a while, just to get out of the house or have a change of pace. Intellectual might be listening to a podcast or reading a book or doing something that stimulates your curiosity, maybe something that you felt like you haven't done in a long time. Physical well-being, something we all know about, is exercising, eating well, sleeping well. So though, like I had mentioned before, those might be areas that you might notice first as signs of, hey, I might need to take a little bit of a closer look at some of these things, right? And then emotional is, asking for help or figuring out who your support is. And it's not necessarily that we ask caregivers to have caregivers sign up for them, but, for example, if you're a wife and you're taking care of your spouse, maybe a thing that you could do for yourself is, hey, on Thursday evenings, I have a book club and I am going to attend that, and I'm going to be, unreachable for an hour. And that's just time for yourself to kind of recenter and get back to the things that you enjoy doing, right? So those might be some areas to think about. It's when we talk about self-care, it's not always just grabbing a snack or going for a walk. It can also be a lot of different activities. Again, things that you used to do that maybe you weren't doing in the recent time, or, more recently as your loved one has gotten more ill. I don't know if Josh has anything to add to that.
Yeah, I think when managing that kind of stress, it's good to have a tool or a plan for like immediate relief, and medium relief, and then long-term relief. And coming up with immediate relief, just in a moment where it's just so stressful and overwhelming, walk away. Just walk away. And just take a minute. We practice a lot of mindfulness, and sort of stoicism with that, this idea that recognizing that you feel bad, and then really thinking about what about this is making me feel bad, and then choosing to react after that. I think those are tools that are really good for just this immediate stress when you just want to feel like you break down and cry and stop helping. And then coming up with a medium plan of, okay, I can get through this week. Like Dr. Patel said, on Friday, I'm going to go to coffee with a friend, and we are not going to talk about the recipient. And then long term, once things are better, I can do more things for myself, and then we can start doing things together, and everything doesn't have to be focused on the transplant. So I think for caregivers, coming up with a plan and specific tools that work for the immediate, the intermediate, and then the long term is a good way to kind of break that up. So that's all I have.
I love that though, because I think it is so, right. It's so overwhelming in the big picture. I mean, people, right, caregivers often are like, you want me to self-care? Like, I don't have time to self-care. And like to even the reframe of wellness, right? And what do I need to do to kind of also be healthy and well, so I can be a good caregiver, but also fulfill these other roles and responsibilities I have and feed myself, right? So sometimes that takes distance from like, the illness.
Yeah, and Dr. Patel had said, you know, when any emotion becomes super overwhelming, start at the super basic things. And the idea is if you take care of your body, your mind will follow. If you take care of your mind, your body will follow. So if you're an intellectual person, that's where you start at the top. If you're a physical person, you start at the bottom. And I tell people, what was the last meal you ate? And when you're eating a meal, even if it's one meal a day, is it reasonably balanced? Are you drinking water? Sometimes people go days on drinking water. All I've had was coffee. Are you getting any exercise, even if it's walking around the house one time? And then those things kind of get that body working again, and sort of feed the machine. And like she said, if it's an intellectual idea, like, okay, then what do I do that makes my brain feel calm and at ease? And do those things, and then you'll start to sleep better and feel hunger again, and your body kind of follows that. So those are my 2 cents.
I think I'll add to that too. I think another kind of obstacle that I see a lot of even recipients, I mean, outside of just the caregivers, is setting realistic expectations and, expectations for myself as a caregiver, expectations of what I'm able to give as a caregiver. I think those are also important because if we set these lofty expectations and we're just never meeting them, then yet here's another thing that I'm feeling: anger, frustration, guilt, insert emotion here, right? So, we're all human. We all have the same 24 hours in the day. And so what we are able to do in that time is not always a reflection of how good we are at caregiving, right? Sometimes doing what we can is good enough.
I always tell patients and families, we're not on Dr. Patel time anymore. You're on transplant time. Right? You are going to want to heal faster than your body will allow, and so you got to slow your roll a little bit. And patients and families, the family's sick too, are sick for so long, and they just want to hurry up and get better, and it doesn't work that way. So yeah, a realistic explanation or expectation. I feel like that's a constant part of Dr. Patel's and in my job is normalizing their feelings and okay, let's rethink these timeframes.